Yeah, I think it's very important to understand that when we say translation, the real meaning of translation is the commercialisation so that it can actually be a product that's used in patients. Yes, of course, there's kindness, caring and human qualities, totally. And healthcare would be nothing without those kindness, caring, compassion, qualities in humans. So the way I thought about it when joining Boston Scientific was I went from being a physician, a clinician, to now a role as the Global Chief Medical Officer and Executive Vice President, trying to help the company with their directions for healthcare going forward. First, we need healthcare solutions that run parallel to the course of disease. And then if we're actually investing in disease treatment options, what do we actually need? We need smart, simple, safe and skinny. And by skinny I mean not too costly, because that's the thing that was going to lead it to have widespread utility. Then you say, well, what else matters? Well, you need to empower patients. You need to give patients the opportunity to be involved in their healthcare. We live in the era of smartphone and information, so we have to actually empower patients to be involved in their care. And then finally, because we're an ageing population and we can't build hospital beds fast enough, we have to think about care in non-traditional settings. If I could possibly give advice, now that you've chosen your technology and you know what to actually develop, and you're looking for funding or you're looking for an exit, the advice I would give you is don't pitch to a company that it doesn't align with their strategic goals. Most of the times when I was at Boston Scientific and I saw Australian companies presenting either to get money or to actually be acquired, they hadn't really thought through whether their product was aligned with the company's strategic goals, and that's so easy to do. And then there are so many other important points about how you get money. And the first is not to be in raptures about your science, because so often you see Australians presenting for money and they think the euphoria and excitement around the science is enough to actually get investment. But the truth is, we wouldn't speak to you if we didn't like the science in the first place. We already know it's a good idea. What we're evaluating is your ability to take this through a proper commercial pathway. Do you understand the market? Do you understand the regulatory framework? Do you understand the manufacturing pathway? Do you have the wherewithal, the resilience and the capabilities to bring together a team to run the clinical trials or to do the benchtop evidence to take the product to market? So we're evaluating you. So as I said during the talk, there are 4 Ps that matter in medical technology: the people, the people, the people, and then the product. And so a lot of the evaluation in the pitch is about you, your timelines, your value inflection points, not about the sheer excitement or splendour of the science. The biggest shift in inventions in the biotech field will come, I'll say there are 2. I'd say dealing with ageing and frailty and healthcare in non-traditional settings. What are the technologies we need to allow people to be personally empowered, live at home and be managed in their care? The second is the growing burden of mental health and psychological diseases. What technologies, other than medications, could be safely and easily used to help those patients who suffer from anxiety, depression, attention deficit disorder, chronic imposter syndrome, who knows? But could it be an earring that you wear or a pair of glasses? I'm going to add one more in. I would say artificial intelligence. I think artificial intelligence is transforming healthcare in a good way. Now, we all fear the unknown and the dire consequences of mismanaged AI, but I think well-established artificial intelligence and machine learning is going to do a lot of simple tasks. And it's going to do a lot of simple tasks in a more consistent, reliable, reproducible way than the vagaries of the human who has an off day, a down day, a sick day, a bad mental health day, who's worried about other things. So it will see the things the human eye sees more accurately, more precisely, more consistently, but it also has the ability to see things the human eye will never see.